Let's bring in Niall Dickson now. And we have seen this extraordinary expansion of capacity, haven't we? Many hospitals doubling, trebling the number of intensive care beds that they have. But do you think that that will be adequate, and with particular concerns for London?
Well, I wish I did know. I mean, the NHS and indeed the wider social care system's just bracing itself for a massive surge in cases. We don't know if the preparations will be enough, but they're certainly extensive. Every organisation that we've talked to, all our members, they've changed the way that they're doing things in a quite extraordinary way. And we've seen this massive release of capacity within the system and huge increase in the number of patients who can be treated in sort of intensive care, respiratory support. I think there are three things that they're looking at to judge whether this surge will be right or not. And you've talked a little bit about this doubling of cases. I think it's currently about every 3.3 days we're doubling cases. So you need to keep an eye on how quickly is that going. Secondly, what's the length of stay in our hospitals? How efficient are we at avoiding admissions and discharging patients quickly enough? And social care is a real problem there, because they might normally have a 9% vacancy. I understand it's now about 2%. So the NHS is going to have to start doing some of that stuff itself. And the last point, and perhaps it's the biggest and most important, you've heard it 100 times before, is how compliant are we at social distancing? And if we are compliant, then I think there's a degree of not optimism, but there's just quite a bit of hope that we may be able to avoid a surge, even in London, which would cause the thing to topple over. We've got the independent sector beds to draw in, and we've got the Nightingale Hospital. But again, staffing, as I think Mike's just made the point, staffing is absolutely critical. We shouldn't be cannibalising everything else just to make the new hospital work. And it is a question of just planning that we put the staff in the right place.
Niall Dickson, Mike Adams, thank you both.